Hello, my name is Trenton Ridge, and welcome to this presentation on differentiation and engagement in the classroom. Today's content is going to be specifically targeted towards our labor and delivery nurses. Now, as an OB nursing EHR educator, I have seen firsthand the challenges that our L&D nurses face when learning and adapting to the epic EHR workflows. So today, I'm going to reflect on how some differentiation and engagement combined with some brain-based learning principles can strengthen our epic training program and improve the retention of the information that we're teaching our nurses and overall enhance our patient safety. So as the L&D department have a lot of stakeholders, this presentation is designed for various roles ranging from nursing educators to super users to the informatics teams and then even the administrative leaders. So the purpose of this presentation is to demonstrate how applying neuroscience-based instructional strategies improves the retention in the classroom, decreases those documentation errors, which ultimately supports our ultimate goal. This is to maximize patient safety in this high-risk obstetric environment. So what is differentiation? Well, differentiation involves aligning our instruction with how the brain learns the best. When we differentiate our instruction based on what our nurses' readiness levels are, their overall experience, as well as their stress levels, we can support engagement and build towards a long-term memory. This means that modifying our instruction to meet our caregivers regardless of where they are. In an OB EPIC classroom, this includes recognizing those differences between our new graduate nurses, more experienced OB nurses unfamiliar with EPIC, and those caregivers that are veterans to their medical workflow and with EPIC, but maybe transitioning to some new additional tools that might be added to their day-to-day. So adjusting this complexity and the delivery of the information is going to ensure that the amount of information our nurses are receiving, which can be a lot, remain manageable while still promoting that mastery of the system as they progress more and more. So when instructional designs connects to prior clinical experience, the brain is going to encode this information more effectively. Emotion also plays a key role in memory formation. So when learning is meaningful and relevant to the patient care, that retention is going to increase significantly. L&D nurses frequently document in a fast-paced, high-acuity situations, ranging from fetal monitoring to the progression of their labor and those unavoidable potential obstetric emergencies. So when differentiated strategies come into play, that might involve time simulations that replicate real charging cadence, visual workflow maps such as Visio for those who need a little more structured, also paired discussions for social learners, as well as those independent challenge tasks for those advanced super users who like to operate on a more independent level. These are options, and these learning options can set the stage for differentiation that is going to allow all of our nurses, regardless of their learning preferences, the opportunities to meet the same learning outcomes while reducing that information overload. So, what are some of these differentiational approaches that we can incorporate for our L&D nurses? Well, one potential strategy consists of a tiered simulation. And this aligns complexity with learner readiness. And in this strategy, the beginners focus on the foundational navigation and documentation, such as basic flow sheets and care plan comprehension. Now, our intermediate learners are going to practice a little more advanced workflows, such as labor progression documentation, fetal heart rate monitoring charting, and then our more advanced learners can manage emergency documentation scenarios that are real-time based and customized note writing strategies. Reducing that workload, strengthening the scaffolding process practice is going to support this neural pathways through the repetition and clinical relevance. Now, as I mentioned earlier, options or choices is going to increase this learner's independence, which enhances motivation. Some nurses benefit from visual reinforcement, others from tactile repetition, and some from more collaborative problem solving. So differentiated brain-based instruction is going to promote this inclusion and deeper engagement across these varied learner profiles. So what does this mean for our nurses? Well, if we give them the freedom to learn based on how they best absorb that information. We can allow them the opportunity to make the most out of their learning experience. So for those that prefer a more visual learning method, we have training documentation worksheets that collaborate with instructional videos that are already on the EHR system that can be obtained directly from that software without them having to go to any additional third-party websites. For those that prefer a little more hands-on approach, we offer exercise books that are combined with simulation labs. We also offer collaborative workshops and collective skilled nursing webinars that are going to incorporate group brainstorming sessions and bring multiple perspectives and workflow strategies from various care areas, such as the NICU and our inpatient pediatric units. So by utilizing these options, our caregivers have the best chance of starting off on the right foot within their respective departments by spending less time on that computer and more time directly caring for our patients. Now, let's talk about engagement in the classroom. So, engagement is essential when we are training our L&D nurses so that they can properly use this complex EHR system, because meaningful learning requires a little more than just passive exposure of information. In a high acuity OB environment, nurses must document quickly, accurately, and confidently while managing these complex clinical situations, such as our fetal distress, performing maybe an induction or an emergency C-section. So when nurses are actively engaged through realistic case scenarios, while having hands-on practice using the equipment combined with this EHR, all while we're providing consistent feedback and they're providing feedback for each other, the brain prioritizes and retains this information more effectively. So brain-based learning research shows us that attention, emotional relevance, and active participation are going to strengthen these neural connections and improve long-term memory formations. If EPIC training feels disconnected from real clinical practice, nurses may memorize these steps temporarily, but are going to struggle to actually apply them in the real time when they're under the pressure. However, when engagement strategies connect documentation workflows to an authentic L&D experience, these nurses are going to start to naturally develop a deeper understanding. They're going to recall this information faster, and they're going to have more confidence in their workflows and the buttons that they're clicking. So ultimately, some strong classroom engagement supports both the documentation accuracy, and we're always going to come full circle back to the patient safety that's on their unit. So let's discuss some other potential strategies to promote learner engagement in our classroom. So a primary tool that's commonly used is scenario-based instruction, like we mentioned earlier. This is going to activate that emotional and cognitive centers of the brain at the same time, which is going to strengthen attention and memory formation. So in a labor and delivery training, our simulated obstetric emergencies, such as a postpartum hemorrhage or a shoulder dyssocia documentation or an emergent cesarean, these workflows create a sense of urgency and the clinical realism that's involved outside of the practice. This urgency is going to increase that neural activation through brain-based learning, helping nurses encode that information more deeply and retain it longer. So beyond simply presenting a case, the scenario-based learning should include decision points, time-sensitive charting requirements, meeting those nursing standards and meaningful use, and structured debriefings. So nurses must navigate fetal monitoring, medication administration records, and provider communication between the doctor and the nurses within EPIC during the simulation. Once again, they're not necessarily just memorizing the steps, but they're actually applying this in a real-world context, which is going to keep on maintaining those neural pathways and retain that information more effectively. Now, the debriefing afterward is going to also enhance retention by promoting a reflection and metacognition, allowing nurses to analyze what worked, what didn't work, and how can we improve. Additional engagement strategies can include more collaborative team-based challenges and immediate feedback within that EPIC training environment. From a biological perspective, small group problem solving and fosters more social learning, which is going to increase dopamine release and promotes motivation. So immediate corrective feedback prevents the reinforcement of incorrect documentation habits, of course, but also strengthens accurate workflow patterns, developing more of that confidence. Incorporating elements of gamification, such as this time documentation drills or accuracy competitions even, can also increase engagement without actually compromising our professionalism. These strategies are rooted in this brain-based learning, and it shifts epic training from a passive instruction to an active clinical rehearsal for our L&D nurses who work in these high-stake, fast-paced environments. This level of engagement is not optional. It is essential for building confidence, competence, and patient safety. Now, from organizational impact, applying this differentiation and engagement strategies in our EPIC EHR training is going to lead to measurable organizational outcomes as well that extend far beyond the classroom. So when instruction is tailored to varying levels of experience and delivered through active brain-based methods, nurses develop a deeper understanding and stronger retention of these documentation workflows. This also ultimately will expand out and snowball into decreased legal risk, a more foundational regulatory compliance, and supports more reliable quality reporting that has to move up and back down the chain. So in a labor and delivery setting where fetal monitoring, interpretation, and medication timing, this consistent documentation and emergent interventions must be precisely recorded. Accurate charting is critical for both the patient safety and from a medico-legal protection perspective. So differentiated instruction is going to ensure that our novice nurses are going to receive structured guidance and repetition, while experienced nurses are going to engage in a little higher level scenario of complexity that's going to mirror real clinical urgency. This is going to prevent those gaps in competency and reduce variability in documentation practices across the unit. So when engagement strategies such as these simulations, these real-time feedbacks, these case-based problem-solving scenarios are incorporated, our nurses are most likely going to internalize the correct workflows rather than just memorization. As a result, less documentation errors, less backdating and late entries, and complete records are going to decrease as well. In the end, confident nurses also just chart more effectively. When cognitive load is reduced because workflows are well understood, the nurses are going to spend less time navigating that system and more time at the bedside. And this improved efficiency is going to reduce charting fatigue and frustration, which can contribute to burnout. Now, from an operational perspective, streamlined documentation is going to support productivity benchmarks. It's going to improve interdisciplinary communication, and it's going to enhance the continuity of care. And most importantly, our patient-centered care is going to improve. When nurses are not overwhelmed by the technology, they're better able to focus on the therapeutic presence, bedside manner appropriateness, patient education, and timely interventions with their care plans. Leadership is ultimately going to benefit from stronger quality metrics, improved patient satisfaction scores. If you would like to know more about the information about differentiation and education in the classroom, please feel free to explore the listed resources. With that, I hope you enjoyed this presentation on differentiation and engagement in the labor and delivery EHR classroom. I'd like to thank you for your time and your attention today, and thank you for being caregivers. God bless.